So a common question I get is how do the medications work? So without really delving into the basic science too much, the best way to do it is to split the effects on your GI tract, right? Like your stomach and your intestines and your endocrine system. These medications for the most part came about through research on diabetes. And some iteration of these medications has been around for over 10 years. And older generations of the medications, we're going to call them GLP-1 receptor agonists, like semaglutide, basically were initially developed and used for diabetes management. And then what physicians and the pharmaceutical industry realized is that people with diabetes were also benefiting from weight loss when they were on these medications. And so light bulb went off and more research went into it. And then we started getting FDA approval for these medications for strictly weight management, not just diabetes. Now, of course, some of these medications are prescribed off-label by physicians, meaning that you can take something like Ozempic, which is only FDA approved for diabetes, and it's being prescribed for weight management because we know that the effect is also on weight. But in a nutshell, these medications were traditionally or historically used for diabetes management. Now, the way that they work is through at least semaglutide, and a part of tirzepatide is through GLP-1 receptor agonist action. And so those receptors have a number of functions. First of all, the GLP-1 hormone is produced by cells on the lining of your small intestine and to some small degree in your brain. And on your digestive tract, what they're going to do is they're going to basically put the brakes on your stomach, your intestines. So they delay gastric emptying, which means that it slows down the emptying of your stomach, right? When you eat, food goes down your esophagus, it goes in your stomach. Your stomach is a big bag of muscle. It's a mechanical grinder, and it's essentially going to grind everything up mechanically and also provide some enzymatic digestion through the stomach acid. Well, your stomach should, in a normal healthy stomach, empty out in 1 to 2 hours. Well, the medication is going to help delay that emptying so that your stomach is not going to delay as quickly. Well, what do you think happens when food is staying in your stomach longer? It's basically going to tell your brain that you're not hungry for a longer period of time. So your feeling of appetite is going to be prolonged or delayed. When it finally does empty out of your stomach, right, the transit time through your intestines is also going to be delayed. So it's basically like driving down the freeway and putting your foot on the brakes. So it's slowing everything down. It's one of the reasons why one of the common side effects of the medication is constipation, because it's putting the brakes in your digestive system. Another major effect that the medication has is on the endocrine system, right? So as I mentioned earlier, these medications were initially designed for diabetes management. So they impact how your blood glucose or sugar is regulated. And so especially in type 2 diabetics, where there is a problem with resistance, you are having increasing levels of insulin to make up for that resistance by your body for the sugar. And so what GLP-1 is doing is it's helping with that regulation of your blood glucose. And so that is a direct effect on blood sugar management. Also remember that things like insulin also promote fat deposition, right, or lipogenesis. So it's one of the reasons why there's a big connection between people with type 2 diabetes and higher levels of insulin and visceral fat, because that insulin is promoting fat storage. So you're having both a direct and an indirect effect when you take something with a GLP-1 receptor agonist, and you're helping to control your blood sugars, especially if you're diabetic, but you're also helping indirectly with fat oxidation, or at least not contributing to fat deposition.